Welcome to the WMed Specialty Spotlight Podcast, your virtual mentor for choosing a medical specialty and planning a career in medicine. On this podcast, we probe practicing physicians with questions about their specialty, the decision algorithm that helped them determine the specialty was right for them, and then for advice about long-term career planning, irrespective of the field they went into. I'm your host, Dr. Biren Shah, WMed Assistant Dean for Career Development. Before introducing today's guest, just a quick reminder that selected show notes for this episode and all episodes can be found on our website at wmed.edu/specialty spotlight. If you'd like to support this podcast and you are a physician, consider volunteering to be a guest on the WMed Specialty Spotlight by contacting me at biren.shaw@wmed.edu. The specialty of today's show is anatomic and clinical pathology, and the physician here to tell us about it is Dr. Heather Chen-Yost. Dr. Heather Chen-Yost is a fellow in the Thoracic Pathology Fellowship Program and clinical instructor in the Department of Pathology at the University of Michigan. Dr. Chen-Yost earned her Bachelor of Arts degree in Integrative Biology at the University of California in 2013. Following this, she pursued her medical degree at Western Michigan University Homer Stryker MD School of Medicine in 2018 and subsequently finished her anatomic and clinical pathology residency from the University of Chicago. Dr. Chen-Yost further specialized in cytopathology through a fellowship at the University of Michigan. In her academic pursuits, Dr. Chen-Yost has contributed significantly with 13 peer-reviewed publications and 14 abstracts presented at national meetings. Her research interests are on the correlation between molecular findings and morphology, emerging diagnostic techniques, and digital cytology. Beyond her research, Dr. Chen-Yost is actively involved in professional organizations serving on the Research and Current Concepts Committee of the American Society of Cytopathology. Her dedication and expertise has garnered recognition, including being the finalist for the American Society for Clinical Pathology Academic Excellence and Achievement in Pathology in 2016, receiving the Outstanding Pathology Student Award from WMed in 2018 and securing first place in the Chicago Pathology Society Research Competition in 2020. Dr. Chen-Yost's clinical interests lie primarily in pulmonary pathology and cytopathology. Additionally, she is committed in mentoring medical students aiming to enhance their understanding of pathology as a career path. So without further ado, Dr. Heather Chen-Yost.
Hi, I'm glad to be here. Thank you for inviting me.
Well, I'm glad you're here. First of all, thank you so much for taking the time to talk to me. So you heard me read your bio, and is there anything that you'd like to add? And then maybe you can take us back in time before medical school and walk us through your decision to go to medical school.
Yeah, I decided to go to medical school late in high school. I had initially grown up thinking I was going to become a veterinarian. Actually, I liked animals and I thought it would be interesting to essentially be a doctor for animals. However, after some volunteering experiences, I realized maybe I don't like animals as much as I thought I did. I still like them, just not enough to maybe become a veterinarian. So then I decided maybe I should pivot towards going into medicine. So when I did my courses at UC Berkeley, I essentially focused on the pre-medical requirements, and then ultimately decided to pursue a degree in integrative biology with a focus on human health, essentially. I had also decided to do a minor in Scandinavian studies in the meantime, which was just more for fun. During my time at UC Berkeley, I did take a class that are known as decals at Berkeley. And so these are 1 unit courses that are student-led, and the course that I took was called Pre-Med 101. I decided to take it because one of my floor mates at the time said, "Oh, Heather, you're interested in going to medical school? Like, I am too. Let's go do it together." And I was just like, "Yeah, let's go." And it essentially was like taught us like what does it mean to go into medicine? How do you prepare for your applications? Like, what are things you can do to prepare yourself for going into medical school? So, because it is technically like a credited class, like we had to do some homework assignments for it. So one of the assignments was look up a specialty and then like write about it. And I think I must have been on Wikipedia. I honestly don't remember how I came across this. Um, but I came across a description of pathology and thought, oh, that's really interesting. Like, I am interested in like diagnosing diseases and trying to figure that out. And wrote about it basically. I was like, this is really fascinating. I like that it involves like looking at tissue or like putting together lab values to try to figure out what's going on with the patient. So the summer after my freshman year of college, I wanted to stay in Berkeley. So I decided like maybe I will contact people at the University of California, San Francisco, and see if they would be willing to have me shadow them or do some research in their labs. And I was lucky enough that one of the labs there let me uh, join them for the summer, and then a neuropathologist at UCSF let me shadow him. So that sort of cemented my interest into going to pathology. So I did that, and I essentially had the idea like I want to be like go to pathology residency after medical school, and I was very gung ho about it. Kind of an aside, like I did take a year off in between college and medical school. And I had worked at Theranos basically, which is extremely infamous now these days, and essentially doing clinical pathology, but like, in a very light sense. And that was an interesting experience. I learned a lot from it, both how to run a company and how not to run a company, and also just the basics behind clinical pathology. And after I got my acceptance at WMed, I quit that job after a few months. I just needed to pay my rent, I guess, basically. And after that, I left.
And the way I like to start is by reading you a description of the specialty from the Careers in Medicine website, which is hosted by the Association of American Medical Colleges. And then I'll ask you what you think.
Mhm.
So here it goes. A pathologist deals with the causes and nature of disease and contributes to diagnosis, prognosis, and treatment through knowledge gained by the laboratory application of the biologic, chemical, and physical sciences. This specialist uses information gathered from the microscopic examination of tissue specimens, cells, and body fluids, and from clinical laboratory tests on body fluids and secretions for the diagnosis, exclusion, and monitoring of disease. How much of that do you agree with? What would you add or subtract to ensure that anyone listening was well informed of the practice of anatomic and clinical pathology?
Yeah, I would agree with that statement. I feel like that's very good. I like how it includes both anatomic pathology and clinical pathology. I think when we think about pathology, as you had mentioned, a lot of people think about anatomic pathology, which is essentially when we look at slides underneath the microscope, and that's usually from biopsies or organ resections, sometimes from an autopsy. And I think the inclusion of clinical pathology, which is run by people who are either um, doctors in pathology or those in PhD with a special interest in those fields. I think that's a good inclusion. I also like how they talked about that we don't just diagnose, we are also integral in the management and treatment of diseases. I think that is something that people don't realize is that there are a lot more diagnostic things that we can do to help guide clinicians in finding appropriate management, such as when we look at a biopsy, say for lung cancer, oftentimes we don't just tell them what type of lung cancer it is, but also our role is to tell them what molecular mutations are in that lung cancer, so then they can see like what sort of targeted treatments this patient can receive instead of, which has been a really huge benefit in the progression of lung cancer treatment.
What would you say is really the difference between anatomic pathology? I think you touched upon it a little bit, but the difference between anatomic pathology and clinical pathology.
Yeah, so these are two different, I guess, branches of pathology, and each of one of them you have to be board certified. There are residents and clinicians who only specialize in one or the other. Most people end up doing both. I would say anatomic pathology is more of that traditional, like you look at a microscope, you look at cells, and you come up with a diagnosis. Clinical pathology is essentially like a lot of the other lab stuff. So, like every time you get blood drawn for a lab test, like a clinical pathologist will be the physician who oversees a laboratory. And then there are individuals, typically medical technologists, who run the samples and make sure the machines work properly. It also involves microbiology. So anytime you send a culture off, like the pathology department is involved in identifying the species that are growing in these cultures. And then there's also blood bank, which is involves the storage and also proper utilization of blood products for patients in the hospital. So, and that's sort of like a brief overview of clinical pathology. There's more involved in it too, such as like cytogenetics and immunophenotyping. So, it's essentially like anything you can think of that you click on the box to order a lab test. Typically, a pathologist is behind the laboratories that run those tests.
The reputation of pathology is that you virtually have no patient interaction. And so, if you want patient interaction, pathology may not be the specialty to go into. How much of this is true? And are there exceptions in which you do have patient contact?
Yeah, I would say, for the most part, most pathologists don't have patient contact. It is, essentially you're more of like the physician for the physician. It's not like I know there's a reputation that you sort of sit in your office and you look at your scope and talk to anyone all day, but I don't think that's necessarily true. I think that you're in constant communication not only with your other fellow pathologists, but also the clinicians to try to explain to them what's going on. Um, in my case, I did a fellowship in cytopathology, and that's one of the few subspecialties that does interact with patients. So in cytopathology, one of the things that we do is something called rapid on-site evaluation, also known as ROSE. And there you are present in the patient room while they're getting their biopsy and evaluate to see if their I guess biopsy is adequate or not, like adequate for diagnosis, or and sometimes you give like a preliminary diagnosis for the clinician, so then they can figure out what to do next in terms of like where to target for biopsies, um, and if we need to get additional material for like additional studies. Some cytopathologists also perform their own biopsies. So during my fellowship and during residency, I performed my own biopsies on patients. And usually that was just to collect material. So I have done both like what we call palpation guided by needle aspiration. So if I feel a lump, I would then put a needle in it to try to collect material for analysis later, or I would sometimes have to use an ultrasound if the nodule of interest or lesion of interest was difficult to palpate, basically. So cytopathologists are one of the few subspecialties that do interact with patients, and I was drawn to it for that reason because I do like interacting with patients. Blood bank is another subspecialty that sometimes interacts with patients depending on what hospital you go to. Where I did my residency, the blood bank was in charge of apheresis, and that's essentially when there is an exchange of like products in the blood, like from a patient with like I guess another, so like I guess a blood exchange, for example, or plasma exchange. And there you have to talk to patients just to see like how are they doing, like what brought them here, and then evaluate them so you can calculate what's the appropriate like amount of plasma or blood that they need.
You kind of touched upon, some of the subspecialties. And when I went on the Careers in Medicine website, there lists quite a number of
Yeah.
subspecialties in pathology. And I didn't know if whether you wanted to kind of share any of those, like, fellowships. There's like forensic pathology, there's,
Mhm.
just various different ones. And I don't know if you want to kind of touch upon.
Yeah, there are a lot of subspecialties. That is very true. A lot of them, I think, belong in anatomic pathology. And I would say a lot of those are also what is called like non-ACGME certified. So those are the ones where you don't have to take boards, basically. It doesn't really affect anything with jobs. It's just like those just don't have a board exam affiliated with it. A lot, I mean, essentially any organ system you could think of, there's probably a subspecialty fellowship for it. So like there's pediatric pathology, which is actually board certified. I'm doing lung pathology. Some people specialize in like gastrointestinal or genitourinary. And then there are subspecialty fellowships in both like anatomic and clinical pathology. So clinical pathology, as I mentioned, you could do blood bank fellowship. You could also do microbiology and chemistry. Yeah, so there's a wide variety of things that people end up choosing for their fellowship.
And do most people after residency do a fellowship, or can you just go out and become a general anatomic and clinical pathologist?
I would say most people do a fellowship these days. A lot of the jobs that you look for are looking for people with certain additional subspecialty training. If you back in the day, maybe like I don't want to say like 10 years ago or so, it was very common for people to do two or more fellowships. A lot of these fellowships are 1 year. So you would do maybe add an additional 2 years to your basic residency training. But nowadays, I think more and more people are only doing one fellowship and then getting a job afterwards. I think that's more possible. I think for like academic pathology, you essentially need to do additional fellowship in order to have a job. A lot of these places are looking for people who have subspecialty training. For private places, I think it may be like a smaller area, like a smaller regional area. Maybe you could get away without doing fellowship training, but I would say the majority of like the private practices are also looking for people with like subspecialty training. I did have one co-resident who did not do fellowship training, but he was also working had it was part of the Air Force. So for them, like his service had to be after his residency training. So he didn't do any subspecialty training then, but I think after his Air Force service is over, he'll return back and do fellowship training.
I would like you to put on your hat of a general anatomic and clinical pathologist. Can you tell me what a typical weekly routine looks like? And what are the typical series of, I guess you could say, specimens or patients that you would see? And what are the typical series of outcomes for these patients or specimens?
Say for like a general overview of most pathologists, you would typically daily get a set of cases, and that's essentially like whatever material comes from a certain patient. Like say they had a biopsy, you would get certain slides for it. Or if they had like a organ resection, like say they had their colon excised, and you would get a certain amount of slides that were taken from the sections that you chose for from that colon. You would look at the slides, see if you needed to do any additional studies, and that is usually what that means by additional studies is we can use what are called immunohistochemical stains, and those are studies that I think like can help characterize a certain tumor feature a little more, or if you need to do additional diagnostic things, those studies can also help with like diagnostic or treatment related questions, basically. Like I guess for one example, sometimes you get a biopsy and you don't know is this a metastasis? Is this coming from an organ, the primary organ from which it was biopsied from? So you would want to do additional studies in order to target like what sort of organ it is. And there are certain immunohistochemical studies that, like, when combined together, kind of help you answer that question, which of course you should pair with the clinical and radiographic findings. And then there's also additional stains such as like a PDL1. So that way you can see if like this patient may or may not be a good candidate for PDL1 inhibitors. So that is like part of the biopsy workup. Depending on what you have going on in your week, you could be on call, and that can includes frozen call. And so what that means is while a surgeon is operating, sometimes they want to assess certain things such as margins are a common reason. So they want to make sure the margins are negative, to make sure that they are excising well away from the tumor. Sometimes they want to know what the tumor is, and then from there they can decide what to do with like staging. This is common, I think, in gynecology, oncology. They will send like an ovary, and then we have to tell them, this is this type of ovarian tumor, and from there they can figure out whether or not they need to take additional biopsies or lymph nodes for staging for this patient. So that's part of the frozen section call, and that is a pretty like fast moving situation. Like ideally you want to be able to render diagnosis within 20 minutes of receiving the specimen if it's small, and then like a little longer if it's like a large organ. But there is like a bit of a time limit to it. And then if you're on call, sometimes if you are also involved in clinical pathology, you would take calls from the laboratory if there's a troubleshooting issue. For example, when I was in residency, I would take clinical pathology call, and oftentimes it'd be like a critical value where the medical technologist was unable to reach the clinician or to report the values. And then I would have to figure out who do I talk to report this critical value. When I would be taking blood bank calls, sometimes it would be to approve blood products or not, especially when there was a shortage. I would say during COVID, this was definitely a big issue. We were very limited in the number of blood products we had. So like patients had to meet certain criteria in order for us to approve it or not, because like we were just so short, like for a period of time. So I would say that's probably a good, description of like your typical daily, weekly routine. And then like pathologists are also involved in things such as tumor board. And that's when the clinicians, radiologists and pathologists will gather together, share the information they have about this patient, and then figure out what are the next best treatment steps for this patient. Or if they won't get treatment at all, depending on the situation. And then also just other like laboratory management meetings too. So
And I'm glad you mentioned tumor boards. It definitely tumor boards is really a great place for which students can actually get an understanding about pathology and its impact in terms of treatment. You're kind of like the problem solver in the sense that the answers come from you, and so and that directs patient care. One of the thoughts that students have about pathology is taking, when they think of call and the responsibilities of pathologists, how much of your time do you spend doing like autopsies? And is that something a major part of what you do?
For me currently, no. I would say during residency, you are required to do, I think now 35 autopsies in order to sit for your boards. So that is a part of your residency training, is to be able to do autopsies. If someone is not super keen on autopsies, that most jobs, I think these days are not forensic focused. You don't have to do autopsies. For example, at the University of Michigan, because there are forensic pathologists here, they will do the autopsies for both like the accidents and homicides and suicides, but also the like medical related autopsies. When you're in residency, or if you're at a place that does hospital autopsies, you essentially do autopsies for on the behalf of like clinicians and the patient's families who are interested in like a question like why did this person die. outside of residency, depending on where you go, sometimes you will have to do one autopsy every couple of months. Sometimes like you don't have to do it at all, depending on the situation. So it's not like a huge requirement if they're not particularly interested in autopsy. But for residency training and to sit for your boards, you have to do 35 of them.
In terms of your practice, what does it kind of look for if you were in private practice versus academic versus, government?
Mhm.
Can you touch upon the differences?
Yeah, I can touch a little bit upon my primary knowledge comes from academics, but when I was at WMed, I did rotate with some of the private groups. I did interview at both private and also government and academic when I was looking for jobs too. So for academics, they not only just look at clinical cases, but you are often sort of expected to be involved in research and also some education. So I will be joining the faculty here at the University of Michigan, and I will be doing some research projects and also developing some lectures for the medical students. And sometimes in academics too, you get invited to give talks to certain groups, or you present at conferences as well. So I'll be presenting a slide session with a fellow colleague at a local conference in October. So that's typically what it involves academics. And I think a lot of times when people are debating between academics and private, I would say the additional things that typically are expected of in academics is kind of what draws people away from it, possibly, especially research. I think you don't necessarily have to do research in order to get promoted in academics, but it does help, I think, to have like a broad range of things. And I think most people end up write papers and do publish in journals. Private instead, depending on where you go, I think you can either go as broad as doing like all of the anatomic like things and as well as clinical pathology, or you can go to a place that you only look at a certain number of types of specimens. Like you only look at GYN, like gynecology specimens. You only look at placentas. You only look at like lung specimens, and you do like a combination of those. So it sort of depends. Like there are some places that like you only focus on anatomic pathology, clinical pathology, where you have to do a little bit of both. And then at the government, which I'm thinking more of like the VA, you sort of do a little bit of everything. I had interviewed at the VA and I was expected to both like do anatomic pathology and also help with like running and overseeing a clinical lab and taking call for both things and doing the occasional autopsy if they have one requested at the VA. So that's like a little more general. And then I think I briefly touched on this in my introduction, but like there's also industry too that people can go into. And so that's like a place, not necessarily like Theranos, but like a place where you could be a pathologist overseeing like a clinical lab. So my dad works in industry and he's met like physicians who have gone down that route.
What would you say is the most exciting thing about your specialty? And conversely, what do you consider to be the most mundane?
A good question. I think the most exciting thing sometimes is like trying to figure out what is going on with the patient. I think sometimes like you get like an interesting like biopsy or interesting resection and you're just like, I don't know what's going on. Like this is really interesting. And then like you talk to your colleagues and like you're like working together to try to like figure out what's happening with this patient. And sometimes you see like extremely rare diseases in these patients too, and that can be really exciting. Unfortunately, in pathology, we often joke like the interesting things are not great news for the patients. So that it is a huge downside. So I would say like that's like something that is really exciting about pathology. You just sort of like don't know what you're going to get with the biopsies or with your slides. I would say some of the more mundane things, for me personally, sometimes it is writing the report. Sometimes I like really struggle with trying to explain what I'm seeing and thinking that like makes sense to other people. I would say that's one of the more mundane things you have to do where I'm just sort of like, oh, I gotta like hunker down and like really think about like a way to describe this that sounds like intelligent. And sometimes I like just really struggle with writing these reports. I think it does get easier over time, but like I know in like, my fellowship, that's been hard. Some of the other mundane things are what is known as like the cancer protocol. So, like, say a patient gets like an organ resected, I would say most places now they do what are known as quote unquote the CAP protocols. That's from the College of American Pathologists, and they like have like a certain list of criteria that you need to fill out to describe like what's going on with that tumor. So, like, not just the type of tumor, but sometimes like the grade of that tumor, how far away is it from the margins, like what were the lymph nodes that were sampled, how many of those are positives, and sometimes filling that out can be really like kind of a pain in some ways. Like, oh, we got to look for lymphovascular invasion. I got to go back and look for that. I wasn't paying attention. So I think that that can be one of the more mundane things to fill out.
What do you think is the biggest challenge facing your specialty? And where do you predict your specialty to be in, let's say, 10 to 20 years from now?
One of the things that I think our specialty is moving towards is digital pathology. So, currently radiologists, they are not looking at films any, you're not holding it up like onto light anymore. But pathologists are still looking at slides like on a microscope. But I would say people are trying to move towards scanning the slides and then having them rendered digitally. I know the University of Michigan is looking to do that, and there are some academic centers in the United States that have fully transitioned to digital pathology. That doesn't mean the slides aren't still being made. Of course, they have to be made in order to scan the slides in. But the transition into digital pathology, I think, will be very challenging in general for people who are super used to using a microscope and for them to then transition into just looking at slides on a screen. I think the scanning and imaging capabilities are a lot better than they used to be. But it is still like it's different. Like, it looks different. Like, you have to I think look at slides differently. So that is one of the challenges that I think places will have to encounter in the future. I think another challenge is that um now that we have more targeted therapies for patients, um you're kind of expected to get more and more out of tissue that maybe it might be hard to. So, like, if you have a really tiny biopsy, or in my field in cytopathology, a really small amount of cells, like sometimes you're asked to like not only figure out what type of cancer that is, but also like get enough material to do molecular studies. And that can be kind of a challenge to like triage material and be really mindful of making sure there is enough material left in the biopsy or the it for molecular studies. And yeah, and I guess like there's also artificial intelligence is also a hot topic in pathology now too, and seeing if we can use predictive models. I would say that is probably not going to happen in the next 10 years, honestly. Like, I think it's still very early on, like people are still developing models. There's always the existential threat if that's going to replace pathologists, but yeah, I know, I think that'll be hard to say at this point if that's going to be like replace us, or if they're going to just be a tool for us.
As an anatomic and clinical pathologist, or a subspecialty, how much do you do outside the hospital at home? Do you take really work from home? I mean, do you have a microscope or, I mean, obviously they're expensive pieces of equipment. Do you do anything at home or you just leave your work behind?
You do sort of leave the work behind, partially because like your work like equipment is at work. I think it might change once you get into digital pathology. I would say the work that I have brought home mostly has been in the the form of trying to write a research paper or trying to develop like a lecture, less so of my like actual clinical work. When you take call, that's often home call, so you'll be like picking up the telephone when you get paged, and sometimes you have to drive back to the hospital if you need to look at a frozen section, or if you need to troubleshoot like anything basically. But for the most part, people do like leave their work at work. But it'll be interesting seeing how that changes once you can do it on the computer, to see if that will be the case. Yeah.
What resources, whether it's websites or others, things that you would recommend students to use to learn more about the specialty?
There are a couple of resources. I mean, honestly, like Twitter, or also currently known as X, has a really robust pathology community. I think there are people who post interesting cases and are very like frank and candid as to like what the pathology specialty is. There are medical interest groups too that are online as well. Yeah, I think that's like really great that this is like some a community that people can become a part of that is online, especially because I think like most medical schools maybe produce like at most 1 or 2 pathologists a year, so you're often, like, the only one in your class, so, like, having that online space is one way to learn about the field. There are YouTube videos as well too. One of my one of my co-residents actually started a YouTube video series, about what it's like to be in anatomic pathology, which I thought was interesting. But, yeah, there's just a wealth of online information that didn't used to be there. I think even when I was a medical student, that are available for people who are interested in the field to really get involved with it. So yeah, you get to see some medical students who like are, I guess, quote unquote Twitter famous in our specialty. And then like I forget that they're medical students. And I'm like, oh right, like you aren't actually a resident yet. Like it's so crazy because I know you so well because I see you post all the time. You're so passionate about it. And like you have like written papers about like educating people about pathology, but like you're still a medical student. So there's like a lot of opportunities if people are interested.
Great, and I actually do follow them on X.
Yeah.
They're two actually from the University of Michigan, Dr. Cameron Mirza,
Oh yeah.
um,
Yeah.
and then there's a resident. I think she's a first year,
Oh,
second year
Meredith.
resident. Yes,
Meredith?
Mir-
Yes, yeah, first year
yes,
resident.
yeah. Provide me your like story, how you got into deciding pathology, maybe the any struggles or insights, and when that aha moment came that this was the right specialty for you.
As I mentioned, because I had expressed interest in pathology, I think in my medical school statement, for my white coat sponsor, I was paired with Dr. Joyce T. Young, essentially. And I was like really excited because she was a pathologist, and I was like, I'm so excited. Like I have a pathologist as a mentor. And I talked to her and I was like, I'm interested in pathology. And I remember she was like, well, you don't have to decide right now. Like, you don't have to tell me that because like I'm a pathologist. And I was like, no, 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 I'm actually serious about it. She was like, oh, okay. And like I also had worked pretty closely with Dr. Sarah Shargi also too, who was also like a mentor for me and like the like career development and like residency interviewing stages. I think like my interests essentially came from like doing projects, shadowing on elective, with like these individuals and all the other people that they worked with too. Like all the pathologists were super nice and like super welcoming and just like so excited that like someone was interested basically. I think that's why like I felt like you get like kind of the red carpet treatment when you're a medical student. And they were all just so like wonderful and like, helping me like get to residency basically, or like preparing me for residency. But I will have to say that like despite like my interest in the beginning, I wasn't like bullish about it. Like I did really try to like be open minded about other specialties. So I did during my third year like think about like, okay, like I'm not going to be like that person who is, I'm only focused on one thing. I don't care about like pediatrics or whatever. Like I did try to like put my effort into it. But I think at the end of it, I did decide like I think pathology is still for me in the end. I mean, like I did like, say for example, surgery. I ended up liking that more than I had expected. But I think like for me personally, like I really like the diagnostic parts of medicine less so than the management part. So that's why I sort of and ultimately decided to stick with pathology in the end. And that was like, yeah, what I did during my third year.
As far as the field for pathology, and to match successfully in pathology, are way electives necessary?
I don't think so, honestly. Like I think I did do away electives, and that was just more for me to like see how other resident places do it and just see what I would be interested in for a residency. Part of it was also just to live in a place that I wanted to live in for a month. So like that was why I did away electives. Another individual in my medical school class who also went to pathology did not do any away electives, and we both matched. I think if you are interested in a particular location, an away elective can help you get the foot in your door, but it can also hurt you too if you don't do a great job. So I don't think they're
Mhm.
necessary, honestly. Yeah, it's just more for your own personal interest.
How important is research or scholarly productivity to match into anatomic and clinical pathology?
It depends on what you are looking for. I think if you are interested in like a more research oriented residency, I think you should do maybe a little bit of research. There are physician scientist tracks, but those are more for like MD PhDs, and those are individuals who already have an inclination for research, so that might be a moot point. I think it's more important to show that you have interest in pathology, and this wasn't like an afterthought, or like a backup essentially from a different residency.
And is there anything that a student can or should be doing to be a competitive applicant?
Yeah, I think getting involved in like a pathology interest group is one way, or honestly, even starting one too if you don't have one. You definitely need to do some shadowing in pathology. Again, I think like when we were looking at applicants, we're looking for people who are like interested in it. So like, are you if you do any research, that's great. Like you don't have to necessarily, but like if you get like a little abstract at a like a local conference within pathology that might be interesting. You definitely need to like have letters from people who are pathologists as well too, which I feel like should be unspoken for, but like I think that is important to show that you are interested. Yeah, yeah, like anything else that might show that like you have like done experiences like extracurriculars out in this field, because we want to know that you're like interested in it and it's not like a backup specialty basically.
If you could go back and do it again, what would you do differently, and what would you do the same and why?
What I might do differently, and this is like a mistake maybe I tend to make over and over, is I end up like getting too involved in things. I think I spread myself very thin, and I'm like, I want to do this and that, and like I feel like I have to do this and that. I think I would probably narrow my focus a little more and like not get, and that goes to saying like both in medical school and residency, I feel like there were just things I just like got way too involved in and like had multiple things going on and just was like too frazzled about it. So I think I would change that, and that's like a lesson that I've had to learn over and over again. What would I do the same? I think, yeah, I think it was like expressing that interest early on, going on electives, like I started the interest group, which I don't know if it's still going on, but I did start one. And that was like a really great experience to both like show people what pathology is and also like get to know the other pathologists in the department, or in like the general Kalamazoo community a little more. I think I would have like worried less as well too. I think like I was just so concerned about like I have to get like a good step score. I have to do all these things because like I don't know like where I'm going to end up. And I ended up, interviewing pretty well. So I think I would probably, yeah, stress less about doing the mostest.
And the pathology interest group is still alive and vibrant,
That's
so
great.
that's
That's
good.
great.
Um, what would you say is a career mistake that you've seen other physicians make? And opposite to that, what is something that you've seen another physician do well that has made you want to emulate it?
I think like career mistakes sometimes is like I would say like in medical school, like I think sometimes I would see people get so fixated on a certain subspecialty that like I think sometimes the blinders are there that like you don't get like you're not as like open to maybe other options. I think like even if you're like me who is like I'm pretty like I feel like 90% sure I know what I want to go into. I think like you should have a little bit of like that openness to other things too. Because like the thing is like in medical school, like you still have to do well in your other rotations too. You can't just blow them off. And I think like um in blowing them off, you I think take away from the learning opportunities that you could have in those subspecialties. Like for example, in pathology, like I understand that you're not maybe possibly interested in surgery, but knowing like what surgeons do and how they like operate and like why they make the decisions they do, like honestly is very helpful. I would say like in my perspective, sometimes in pathology, people would just be like, "Oh, I don't understand why the surgeon is doing this." And I'm like, "Well, like if you had paid attention to your surgery rotation, you would know like they have to do X, Y, and Z." So I think like that's like one thing that I would say it's a career mistake that medical students and residents have. Yeah, things that I would say like another physician do well. I would say like a work-life balance. Like I really like physicians who really focus on still trying to maintain their hobbies, like and like still try to like not be so dedicated to their career that they forgo like the basics, like having a good diet, like exercising, like staying in touch with friends and family. I think that's something that I want to continue on, and I've tried to maintain throughout like different phases of my medical training.
What is one thing that you're struggling with or lamenting about your career today? And what are you doing to remedy it? And what would you encourage a medical student to do right now to help avoid this problem entirely altogether?
One thing that I know I will struggle with is probably looking at digital slides. I think that's something that I know that I will struggle with in the future. I would say for medical students, I know at WMed they have those digital slides for the pathology curriculum. I would probably spend a little more time learning how to navigate those and like trying to really like figure out how am I going to scan these slides on a digital space. Because I think I know in my head when during that time, I sort of blew that off and was like, well, I'll be looking at slides on a microscope. I don't need to get really good at like looking at it on the computer. I think that's something that I wish I had done a better job at, honestly. That's like one thing that I know I'll be struggling with. And I think another thing I'm going to be struggling with in the future, and I still struggle with, is like writing papers. In my career, like since I'm staying in academic medicine, I think like if I was a medical student, I would encourage myself to maybe like see if there are any courses I could take on like how to write a paper because I know in residency I was very much like confused and didn't know what was the best way to do it. And in medical school, I had done one paper that was pretty much it and it was pretty like straightforward. I think like if you have the resources to like learn more about academic writing, if that's something you're interested in, I would definitely like try to take a course in it or like just go to one seminar just to understand how to do it properly.
What one book, medical or non-medical, that you think every person pursuing a career in medicine should read?
That's a really good question. I don't know. I can think of like books that I really liked during medical school, that I think helped me in some way. I think this is kind of maybe a cheesy one, but I really liked the Art of Tidying Up by Marie Kondo. And
Mhm.
I think, like, her whole thing is essentially, like it's, like, focused on stuff, but I think you can apply it to life too. It's essentially, like, you wanna keep the things that give you joy. You don't, like, wanna necessarily always keep things that, like, are just there for functional like, of course, it's stuff like someti you like, maybe a screwdriver doesn't bring you joy, but you still need to have to keep that around. But I think, like, it's, like, a good concept to have for, like, life as well too. Like, what are things that bring you joy? And maybe you can, like, discard the rest. Like it doesn't spark joy. I really liked that book and it's super short. Other like books that I think are helpful too for me. I really like the book Stillness is Key by Ryan Holiday. I think for me personally, I struggle with like wanting to do too much. So I think and his concepts are essentially like you may want to like slow down a little bit and like enjoy the silence sometimes. Like I think that will actually help you in the future. Those are like more of the non-medical books that I think people who are interested in medicine should read, just to like balance, like, figure out like what are the things that you actually want to do in life.
Dr. Chen-Yost, is there anything that we didn't cover that you'd like to make sure that our listeners know about the field of anatomic and clinical pathology?
Yeah, I would say just to like kind of summarize, like the field is so broad and diverse. It can be overwhelming when you're studying for boards, I'll be honest, because there's just so much that goes on in the field. But I think the other magic of it is that like you can find something that you're potentially interested in the field too. Like you can go into even like informatics for if you're just like a really technical person, or you can like and you don't necessarily end up like becoming someone who doesn't talk to other people, I think like you still have a lot of like interactions with other clinicians and like other members in your department too. So I think if you're worried that like you're gonna be stuck in an office not talking to anyone all day, I would say like that's not like necessarily a true thing. For Yeah, it's like a really it's like a great field for people who are potentially interested in research. I think like it's a really great it gives a lot of space, and like there's a lot of interesting projects for people to pursue that as well. And then also education too. I think like there's also just a wealth of opportunities in that dimension. So it's you don't necessarily lose that part of like your medical career by going into pathology.
The pathologist I interact with at my hospital, she's a very happy person and very involved. I see posts from Dr. Mirza. He's all over the place and, giving talks and very involved. But everyone I've seen that is a pathologist has been very, very happy. And so, well, thank you for that. It's been a pleasure talking to you and being a guest on the WMed Specialty Spotlight Podcast.
I say thank you so much for inviting me again. This was a really wonderful conversation.
Well, I hope you enjoyed that conversation with Dr. Chen-Yost. For the resources and other tidbits that were mentioned in this episode, you can find them in the show notes on the WMed website, wmed.edu/specialty spotlight. If you liked what you heard, please share this episode with your fellow medical students, especially if they're having some career anxiety. It truly is my hope that these conversations with physicians who've been there and done that will help you move forward with your own career choices. For any questions, or if you'd like to reach out to me for any reason, which I encourage you to do, you can do so by emailing me at biren.shah@wmed.edu. But until next time, take care.